people come to me with some pain here and there. Are the orthopedic surgeons the first go-to people for all these small pain? Everybody thinks that the moment you go to a surgeon, he will operate. How do we bust this myth, this fad? As president of Delhi Orthopaedic Association, what are your future plans to rise the standard of orthopedic academics? Hi, welcome to yet another podcast session by Delhi Foot. I am your foot and ankle surgeon, Dr. Abhishek Jain. I hope you would have relished and enjoyed my conversation with Dr. Sriram Rajan as we had in our last podcast session. Today I have with me one of the most eminent orthopedic surgeon and the president of Delhi Orthopaedic Association, Dr. Gurinder Bedi. Hello, very good morning, sir. And he also happens to be the director of orthopedics and joint replacement in Fortis Vasant Kunj. So the Delhi Foot welcomes you, sir.
Thank you so much.
With all great heart. So sir, my first question to you is, like, you are an orthopedic surgeon, what kind of patients do you see? Or in other words, I can ask, who should come to you for his medical problem?
Okay. So Abhishek, orthopedics is a very, very sort of dynamic kind of a branch right now. Mainly because if you can see, so there are so many bones in the body, and invariably kuch na kuch kisi na kisi bone joint mein there are issues which keep on happening.
Yeah.
So we actually deal with mostly, agar dekha jaye, so with the spine, the shoulder to the tip of the fingers, and the whole back, and the groin to the toes. आप बोलोगे तो सारे एरिया कवर करके बैठ गए, but we actually deal with pretty much upper limb, lower limb and spine. That's a major kind of work we do, which obviously includes things like back pain, neck pain, hip pain, ankle, knees, finger pain, some arthritis problems which develop, and obviously fractures, which used to be the bread and butter for most orthopedic surgeons. But the recent trend that we see now is that people are coming more and more with non-fracture related things too.
So, Dr. Bedi, my next question to you is, like, I also face this in my OPD, that many people come to me with some pain here and there. Like, I have a backache since 2 days, I have a wrist pain since last night, I have a neck pain, perhaps I have slept in the wrong way. So, are the orthopedic surgeons the first go-to people for all these small pain, or they should go to their own general practitioner or the family doctors whom they know very well? So what is your take on this?
So Abhishek, I think in a tier 1 city like Delhi, Bombay, Chennai and all, there has been a lot of change in the trend of medical practice nowadays.
Okay.
So which has its own ups and downs. So if you look at it, so in the beginning, there was always this one doctor within the community, within the neighborhood or something that everybody would go to and actually get a startup advice here, what is happening with me, is it serious, non-serious kind of stuff. So this is such a concept which is very, very popular even now in a country like US and UK, where everybody knows the first go-to is this, and use him to guide you in this.
Exactly.
I think what really has happened is our accessibility to medical services now is easy bar none, in the sense that, you know, if you want to see somebody like me, you just have to actually call up a number and go and see him within 2 hours.
And walk in.
Yes. Walk in. So which has, you know, again ups and downs kind of a stuff. So I know it's good for my practice, people coming in.
Exactly.
But if you look at it, it's not really right. You know, there is this sheet anchor, तुम्हारी health के लिए sheet anchor होना चाहिए, which should be that the general practitioner or the family doctor who knows you, who knows, you know, वो सब कुछ इकट्ठा कर देता है, because he knows that you have a blood pressure, you have a diabetes,
yes.
and all these things in the body are linked.
He knows your background.
Exactly.
Yeah.
So everything, you know, body to is one unit only. ये तो है नहीं कि, because a lot of things, you know, might be happening because of your diabetes, other issues.
Yes, absolutely.
Even mental psychological issues. You know, you can have, you know, everybody knows that, you know, छोटी सी चीज इतनी बड़ी हो जाती है when you're stressed out, when you're anxious.
We cannot dissociate mind, body and soul.
Absolutely. Yes. And कई बार all you need is a reassurance to say कि look, you know, take some simple thing And most likely this will get better, and then we'll see where you stand in a few days' time.
So the carry home message is, have faith in your general practitioner, have faith in your family physician. He knows you in and out. He knows your social, family, mental, physical, every background in and out. So just one tip or advice and you'll do all good. Instead of straight going to a specialist and standing in queue and making it big. So we can close this chapter in a small envelope as it is. So thank you very much, sir. My next question is, as I know, correct me if I'm wrong, you graduated your orthopedics in 1993. And today we are sitting in 2023, which means almost 30 years have passed.
Yes.
How orthopedics as a medical fraternity, as a surgical fraternity has evolved in tier 1 city like Delhi or in peripheries, and what advantages, what conveniences, what new technologies have helped the patients?
Okay, so I think Abhishek is a sea of change in orthopedics, which is much more to do with the way that we now live our life. हमारी expectations in terms of हमारे employer की expectations, many expectations from the family, from the fact that आजकल घरों में मतलब the lady of the house goes out to work as well.
Absolutely.
Most of the people are now in nuclear families वगैरह. So वो जो दिन थे ना जब मतलब कि एक आदमी बीमार हो गया तो सारे घर वाले बैठ गए उसके पास. Those days are gone.
Absolutely.
You are totally all by yourself.
Correct.
So पहले जो ट्रेंड था ना कि फ्रैक्चर प्लास्टर लगा दो, आज की डेट में देखो, so how many times you think in orthopedic practice की हफ्ते में कितने प्लास्टर लगाते हो, you'd be very surprised.
Yes.
एक या दो ही लगते हैं.
मतलब
कि मैं नहीं कह रहा कि बहुत बड़ी प्रैक्टिस है मेरी, and I know, but I think that is the general trend.
Yes.
And one thing we realize is, the days of पहले प्लास्टर लगाओ, हड्डी जुड़ेगी, फिर रिहैबिलिटेशन करो, तब तक घर में बैठो, काम पे नहीं जाओ, इतनी देर में तो आपके और मेरे में भी हो गया. हमारे तो प्रैक्टिस ही खत्म हो गई, मतलब कि 2-2.5 महीने में लोग बोलेंगे इसका तो काम हो गया. So similarly, if you are working for somebody, how do you tell somebody कि मैं 3 महीने काम पे नहीं आऊंगा but मेरी तनख्वाह घर गई?
So mobility, movement and back to work is priority.
Absolutely. So now, one way or the other, our aim is to get everybody back on their feet as soon as you can.
As soon as.
So the quicker the function returns, the quicker he's back to work, the more active his muscles are, the more healthy his joint is, and less the stress on the family.
Fine, I got it that the intent has changed.
Absolutely.
How the execution has changed.
Okay. So now, आज की डेट में, even if you have a 89, 90, 95, which is the other end of the spectrum,
Absolutely.
Ki the elderly who are living longer and hence having more and more problems because of the age rate and everything, we realize कि उनके लिए भी the same parameters have applied. So now we are trying to, hip fractures, we all know are so common, vertebral fractures, body ke fractures, so common, and we are doing the same thing for them. Early fixation, back to feet. So technology has actually evolved for everything. So we now have plates, screws, wires, everything which is designed less intervention, ज़्यादा कोई तोड़फोड़ भी ना करना पड़ेगा.
Yes.
But very, very effective things like we have locking plates, interlocking nails, वगैरह. These things are absolutely wonderful. We never had that when we were graduating, as you know. We had the simple एक तारे होती थी, एक कुछ होता था, and we were managing in a very, very poor way. If you ask me, आज की डेट में we look at where we used to be, we have undergone a sea of change. And our information is coming through so quickly. You get somebody makes something in America, within the next 2 months you have it.
And the shelf life of any new technology is so less that the moment you are just settled with it, the new thing has come in.
And I think the transference of technology has become so intense. मतलब कि there is almost that gap जो होता था ना, पहले वहाँ पे आएगा, फिर वहाँ पे use होएगा, फिर यहाँ पे होएगा, and we are very grateful. There are a lot of people being very innovative. In our country, so many people have come with such innovations and all.
Yeah.
The academic forums are buzzing, WhatsApp is buzzing with people discussing cases, taking advice, changing practices, medical information being available, journals being available. I think medical overall, I'm sure the other specialties also, it is such a sea of change which is happening presently, and it has made our delivery of healthcare at such a level that we never ever estimated it to be there.
So you see, time is changing so fast that we got to keep up with the pace of it. Now, we all are here as an orthopedic surgeon to get you back on track. Now for this, that old conservative way of treating you with plasters and bed rest for 15-20 days, or giving you a traction and hanging your lower limb or leg with 2 bricks for like 3 weeks or 3 months is no more there. That brings us to a new Pandora's box. Like, the answer is operate, surgery, fix the fracture, fix the problem, and get the person up and about and moving. So my next question is the tail of it. This brings us to a new Pandora's box. Everybody thinks that the moment you go to a surgeon, whether it's an orthopedic surgeon or general surgeon or a cardiothoracic surgeon, भाई वो तो आपको खोल देगा. He will operate. So it has become a taboo. And most of the time, when genuine people don't visit hospital in the fear that somebody will ask to get the surgery done. Now, how do we bust this myth, this fad that when surgery is required, it is required, not that every time it is required. So what is your take on this in clearing the clouds of the people?
So I think, Abhishek, as you rightly said, there is a lot of mistrust which has developed and very preconceived notions people have. And they, in fact, before you open your mouth to give an advice, people start dictating out, मैं ये भी नहीं करूँगा, मैं ये भी नहीं करूँगा, मैं ये भी नहीं करूँगा. It's almost as if, it is like we are sitting on different sides of the table and, you have nothing to do with me and I'm not going to be very suspicious of everything, which is somewhat unusual. I think we're all familiar with people, ambulances के अंदर बैठे हुए people with heart attack, traveling from hospital to hospital just because people are saying, yes, तुम्हें stent डालने की ज़रूरत है. They went to another hospital and बेचारे, that somebody died in the ambulance because he did not take the trust kind of a stuff. And I'm not saying everybody is sort of absolutely right in everything, but I think you have to place your trust somewhere in the system to understand that, every doctor wants to make you better.
Yes, that is true.
Even if I look at, say, commercial avenues, social, I cannot keep, advising wrong things and hope to have a long run.
Yes.
So most of the doctors, as you know, will be staying in one hospital, one clinic, whatever, for a very, very long time. You don't want a situation where, जो भी आ रहा है, he's filing complaints against you and all that stuff. So it is good for my work, my personal satisfaction, and we all treat our friends, family, relatives. We're not ruthless enough to, just have the preconceived notions that that's what I do. So now the other thing is, orthopedic branch is called an orthopedic surgery. It is not called orthopedic physicians.
Yeah.
But there is no doubt that out of, say, in a private practice kind of a scenario, out of every, say, 100 people that I see, I am not advising surgery to more than about 15 to 20 of them maximum. Most of the things can be managed with a combination of sometimes medication, sometimes supportive braces, sometimes some injections, sometimes physiotherapy, sometimes activity modification.
And sometimes mere counseling.
Oh, exactly. Sometimes mere counseling, just a reassurance and all.
Yeah.
And sometimes just investigating, giving a diagnosis and telling them what the long-term prognosis is. So it is a very small percentage. I'm sure I speak for majority of my colleagues. That's a very small percentage which is actually advice surgery. Most of them will get away with general advice about other things, among the things, which we will try to manage. So things like, these backache, neck aches, shoulder ache, pains, etc. So now majority of them will manage. Knee pains, majority of them will manage. But don't get into a situation where, things are going worse, but you have got your notion in your mind कि कुछ भी हो जाए, मैं surgery नहीं कर पाऊंगा. Like we've seen people, and I'm sure you, torn ligaments in the knee, legs, knee पूरी unstable हो चुकी है, and it's very, very obvious that you're damaging your knee every time, but still you decide मैं तो नहीं कर पाऊंगा kind of stuff. And I think as a community we need to increase the trust that we have from the patient side. And I'm sure it's a combined effort. The patients have to trust us. We also have to answer back to the trust. How do we make our practices more transparent and everything? But the good thing is, people should take another opinions. अगर उनको लगता है कि for whatever reason, कई बार personality clash हो जाता है, कुछ हो जाता है, they should get another opinion and,
Yeah, it is right.
It is absolutely right.
So let us conclude one thing from our from the last point that we have just listened from Dr. Bedi, every doctor means good health to you. He is there for your benefit. He is here sitting in his chamber for your good health. There may be disagreements. You have your own biases. You might have your own opinion. But most of the time, you should not doubt a doctor's intention about your health. It is always for your good. So instead of having your own opinion, reading too much of Google articles, let's start developing faith in your doctor. Definitely a second and a third opinion has its own role, a very vital role, it's your right. But then do exercise it like a DRS in cricket. You should not exercise it every time.
Great.
Yeah. Coming on to the next question, Dr. Bedi, we see a lot of patients coming from outside states like UP, Bihar, or Jharkhand, Haryana, Rajasthan to big public and private hospitals of Delhi.
Yes.
My first question is, why is it so? Is there a difference in the facility and the quality of doctors between these two places? Or is it the difference in the treatment culture, and I'm here relevant to orthopedics, treatment culture of this tier 1 and tier 2, 3, 4 cities? So, and how does the orthopedic fraternity plans to take on this load, take on this patient population challenge?
So I think, Abhishek, you're absolutely right. The trend has always been, centered on going to the bigger tier 1 cities like, like a Delhi or Calcutta or Chennai, Bombay kind of stuff, and say, big centers kind of stuff. And there is zero doubt that the amount of infrastructure development within the healthcare is maybe more within these things.
That's evident. That's very evident.
And at one time, the medical colleges were also sort of centered very much in these kind of places. So I think a lot of things happened because of the way that we've conventionally done. But I think, thanks to a lot of investment now in the other cities, especially opening up other medical colleges, maybe opening up all institutes in other states, there is definitely a trend. Not only that, in private also we've seen that all the other hospitals, that the chains that we have, they're actually opening a lot of centers in the other parts of world, and the overall level, I can tell you, has definitely arisen a lot. So that big gap which used to be there has definitely
come down.
And the number of people, I think, as I'm sure you've noted in your practice as well, is not as much as in other as used to be sometimes.
Absolutely.
There are some things like, super speciality kind of a stuff, like, somebody doing only spine surgery kind of stuff or only foot and ankle surgery. So there is a little trend that they still tend to come out here. But other than that, the gap is much, much less compared to what it used to be. My colleagues in the other cities are doing excellent work now, and I'm very, very happy to see that we hardly are managing, those complications and all that we used to see. The quality of care has gone down. I think, it's an age of information, and everything is getting transmitted so quickly. Aaj ki date mein, the roads are brilliant. The internet is giving us all an access to who's doing what is the good way to learn. We are learning much more.
And academic exposure is reaching nook and corners of the country.
I think that is, we've done much, much better compared to the disparity chali gayi hai.
Yes.
I mean, at one time, the medical graduate from one of the smaller cities compared to Delhi, तो ज़मीन आसमान का फर्क होता था. Today, I can tell you, standardization, which is what other countries did very, very quickly in the beginning, but we lagged behind. But we are now definitely catching up. So it's a good this thing, but I'm also, obviously we for a private practitioner, happy to receive more patients. And there is no shortage of dearth of places within the city if somebody wants to come. But very happy to note that patients are getting a good quality care, and a very standardized level of care.
Okay, that was quite humble and statistical. There was a time when there was a single doctor in a district, and he used to manage everything from head to toe. Then we had bifurcation of physician and surgeon. Then we had bifurcation of speciality surgeon. One is a general surgeon, one is an eye surgeon, one is an orthopedic surgeon. Now we have too much of subspecialty and super speciality within the orthopedic fraternity. For example, somebody is an upper limb surgeon, somebody is only shoulder surgeon, somebody is a knee surgeon, somebody is a hip surgeon. There is an oncology branch, oncosurgery branch in orthopedics. We have foot and ankle specialists. So in today's time, how relevant is this bifurcation from patients and from both doctors' point of view? Because the more tunneling happens, the more bifurcation happens, the outside knowledge diminishes. So being a foot and ankle surgeon, my knowledge about shoulder is not as great as a shoulder surgeon. So how far it is justifiable, or is it good for the society?
Okay. So there is no doubt कि जितना जितना हमारी knowledge base is increasing, जितना our experience is increasing, more and more we realize that actually, as much as I would like to be a master of all, that is not going to happen at all. And we are all understanding that you can actually, follow a focused, driven passion and carry it to extreme levels and become maybe a master of certain things. So because of which I think we discussed how orthopedics cover, I mean, if you leave out the chest and the abdomen cover, everything. So then you start thinking, yeah, but it can't be that easy to sort of, know everything about it.
Master each and every nook.
Absolutely.
Yeah, absolutely.
So I think overall it is a welcome kind of a trend, and we've actually copied this from our colleagues in the West, and they started developing this, and we've actually gone ahead and tried to make it more and more popular. We have now, as you know, we've got courses driven exclusively. Somebody's doing a course just for the spine, just for the hip, just for the foot and ankle kind of stuff, which has actually helped us all, and we're getting experts in different fields flying down, showing live surgeries and all, which has actually helped develop these subspecialties a lot. Overall, it's a very welcome trend, I have to admit, and I think we will all do much better if we focus on what we really need.
So subspecialty at the end of the day benefits the patient. It gives you the right doctor at the right time. It gives you the most experienced and learned person for your particular problem, and not generalizing the entire scenario. That's great. As president of Delhi Orthopaedic Association, what are your future plans to rise the standard of orthopedic academics within Delhi, for the Delhi doctors, the Delhi orthopedic surgeon, and for those who are outside Delhi, who wants to come here and learn more? What are your plans, academic plans?
So as part of our executive committee in the Delhi Orthopaedic Association, what we would very, very much like to do is having mentorship programs for the junior people, which we've actually already advertised. We are actually doing a course almost every weekend. There will be a course for specialties. We will also be opening some instructional course lectures, which will be on different specialties, so the juniors can actually understand the taster for what happens in the specialty, use that option, and also at the same time being able to refer the patient more or get more advice on them. So a comprehensive care, having a much wider depth of the awareness of the problem, and having some experts come down and actually talk to the younger generation people. But there is no doubt that we also want to increase the amount of camaraderie within the community itself. So we are having cultural programs as well, musical nights and everything. It's more to sort of people interact and learn from each other. And there should not be any hesitation in trying to help the other person in case of any need, or the other person to come. So the association will make a bonding between all its members and uplift the level of education.
That's a great plan indeed. That is a very good plan. So we see today that so many good points we have learned from Dr. Bedi. We have got so much of knowledge about the practicality of orthopedic practice from a patient's point of view. So to summarize, we can conclude that yes, have faith in your doctor, have faith in your family physician. He is perhaps the most right person to guide you to a specialist. Secondly, we are here to use technology for you. We are here for your good health. So even if the technology means surgery to you, even if the technology means, or the surgery means early rehab and early back to work, please give it respect. Don't just get a biased opinion that, okay, I won't get the surgery done. Surgery might be the only answer to your solution, and a good one. Not telling you that you should not have a second or a third opinion. Please do take it, that is your right, but then do consider the advice of your specialist or of your doctor. We can see that over a period of last 5 years or 10 years, the difference, the disparity of the medical standard between the tier 1 and tier 2, tier 3 cities have come down. People do flock, patients do flock from third tier city or a second tier city to first tier city, but the population has come down. So we can see that the technology is piercing and penetrating each nook and corner of the country, which is a good thing, which is a very good thing. So that was it for today. I thank Dr. Gurinder Bedi so much that you spent your valuable time with us for educating our audience. Please keep yourself tuned with our channel for upcoming podcasts. Thank you. Myself, Dr. Abhishek Jain, your foot and ankle surgeon.